Hello and welcome to OVIDcast. I'm Roudie Shafie, partner here at Ovid Health. This is our last episode of In Discussions with David Salisbury. Hello, David.
Hello.
So, David, we've had a real whirlwind tour as far as possible around some of the key issues around vaccinations, but we've managed to skirt around the elephant in the room, obviously, which is COVID and the pandemic. Tell us, your work with the WHO, Chatham House, as well as some of the great work you've been doing during the pandemic, in particular, reassuring the public on radio and on TV. So what's next for COVID variants and what are the implications for the vaccines programs?
I think we have to acknowledge that there will continue to be variants. And what drives those will be multifactorial. It'll be low coverage in some parts of the world driving the emergence of variants. And predicting which way that's going is really, really difficult. We're going to see variants, most likely, of Omicron. We're already seeing those. We're going through, an alphabet soup, and we're already down to numbers, 4 and 5 of BA variant of Omicron. So this is happening, and it will continue to happen. And we may find that we are forever chasing viruses, making vaccines, and the time it takes to make vaccines, even with the accelerated world that we live in now, may not actually be fast enough for the way the variants are emerging. So we have to hope that the vaccines, as we are making them, will continue to be effective. Effective, obviously, against death and severe disease, but the social impact of the pandemic, the economic impact of the pandemic, really argues that we need to stop people getting ill, not just severely ill. So we want to be sure that our vaccines are going to work against the variants that will happen. We need to be able to be flexible in the way that we get our vaccines against variants, and what they will be, we follow the viruses.
Great. And have global systems of surveillance, cooperation, or even scientific and sort of vaccines technology advancement, have all of these come to pass after the pandemic to prepare us for the next one, so to speak, beyond COVID?
I think the learning has been dramatic, and the learning has spanned sort of everything, spanned how fast we can make vaccines, how we can license vaccines, how we can distribute vaccines. When we heard that the mRNA vaccines were going to need cold chain requirements of -70, it was sort of unbelievable that they could ever be used outside of a very small number of industrialized countries. But what have we learned? You can.
Yes.
And so, we have seen the barriers, and we have found ways of overcoming many of those barriers. And I think all of the learnings will put us in a very much more secure place. I hope they will. Otherwise there's a very high cost. But I hope that the learnings will put us in a better place to be able to anticipate and then respond to future pandemics. There will be more of the same insofar as we have deforestation, we have closer proximity of animals to humans, we have more opportunities for viruses and bacteria to cross from animals into humans. We have an interconnected world. So all of those risks are there. But we have done well. Nobody thought that we could have got the money given for the low-income countries to be able to access vaccines. Nobody thought we could have got equity in supply of vaccines as quickly as we've been able to get somewhere near it. So I think that there have been many things that have been done that we didn't expect could be done better than we could have expected, and are important learnings for the future.
Yeah, I mean, it's great that you mentioned that sort of equity of vaccine supply and distribution, because of course, as you said, variants can emerge where vaccines coverage isn't broad enough in parts of the world. So what is the obstacle now?
I think we've got over some of the early challenges, and I was one who felt very concerned early on in the pandemic about this issue of vaccine equity, and that I felt that we were talking up the need for ensuring that everybody benefited, but it wasn't necessarily being delivered against the rhetoric. The situation is a bit different now, in that we have been able to provide very large numbers of doses of vaccine, but they're not all being put into people's arms. And the worst tragedy would be if vaccine had to be written off because it had gone past its sell-by date and not used. And implementation and the appetite of the public to be vaccinated is nowhere near as strong as it was. So we find, I believe, ourselves in an uncomfortable place where we've solved some of the issues. We've solved a great deal of the challenge of supply, but we haven't maintained the appetite to be vaccinated, and that's worrisome.
Yes, and it's interesting, you know, this concept of interconnected world. In the UK, we've seen a re-emergence of polio, and some of that is traced back to you know, originating from outside the UK. Obviously, your role at the WHO means you probably know much more than me about polio. So what are your reflections on that, and what should be done?
Nobody should have been surprised to find polio in the sewage in this country. We have a great deal of interchange of people between Africa and between Afghanistan and Pakistan. Certainly this year, a great deal of movement of people from Afghanistan, Pakistan all the time, West Africa, and those are the places where these vaccine-derived viruses, these aren't wild viruses, these are vaccine-derived, but they behave like wild viruses because they can spread person to person and they can paralyze. So nobody should have been surprised that these viruses were found. What I believe is not answered is, how do we know that they are not elsewhere? Because we can only answer that if there was sewage sampling going on in Liverpool, in Birmingham, in Manchester, and in other big cities. And we don't have that extent of surveillance in this country. So was I surprised it was found? Not in the slightest. The worry is the community in which it has been found. And clearly, this virus is spreading person to person within that community. And if that is a community where there is low vaccination in this country, that's a worrisome circumstance. So what can we do? We can get answers to, are we confident that these viruses are not elsewhere? That can be answered. We need to make sure that children are vaccinated, even if they have come into this country, even if they are part of communities with low vaccine uptake. We need to be able to identify who they are and help provide access to services so that they can indeed be vaccinated. So the surveillance in this country needs to improve for polio, because whilst polio exists, either the vaccine-derived or the wild virus, we will be at risk. This should have been no surprise. And we need to wake up to that risk.
That's really interesting. So then looping back to where our conversation started around surveillance, where, you know, have we moved on enough? Have we really grasped the importance of it, both at the UK level, but also globally?
Global surveillance of polio is, for the greater part, pretty good. And in the places where the risks are highest, the quality of the surveillance is highest. if you said to me, how good is the surveillance for
Yes.
polio in the UK, I would say to you, it is not as good as it is in France. It is not as good as it is in the Netherlands. And we should not be surprised if viruses come into this country because of global travel. So surveillance is of huge importance. There are three aspects to polio control. The first is vaccination, the second is surveillance, and the third is wherever polioviruses are being worked on, they have to be contained, they have to be locked up so that they cannot get out. And where polioviruses are being worked on in manufacturers, where they're being worked on in laboratories, we've got to lock them up and show that we know how to lock them up.
Great. Well, thank you so much. What a great place to end our discussion. Thank you for joining me for this series, David, and thank you again for being on the Ovid Senior Council.
It's been my pleasure.